Hey, what's up guys? It's Dr. Sammy, and today I want to share a few tips on how to communicate and connect with your patients. So I had a rough day yesterday. I felt really overwhelmed with patient after patient of care-intensive, complicated treatment plans. And it's always a bit difficult having conversations about compromised teeth and the right way to move forward with treatment. Thankfully, I've spent the last year or so working on my communication skills, and I've noticed a much stronger connection with my patients each and every day. So here are 5 tips that I've learned in private practice. Tip number 1, be an active listener. When I first started practicing dentistry, I would walk in the room full of energy and confidence in my treatment plan. I would use all this technical dental jargon, and you could just see that patients were overwhelmed with the energy I was bringing. And it's embarrassing to admit, but I remember moments where patients would come in with a problem or explaining to me what brought them into the office, and I would interrupt them with a quick answer or a solution without really listening to what it is they want. And that, my friends, is exactly how to lose a patient. Eventually, I learned to shut up and listen. You'll be surprised to notice that patients who claim to only want a cleaning actually want something entirely different. So embrace silence, listen, and follow up with good questions that allow you to understand their concerns and questions. Number 2, share stories. It can be really difficult to break barriers with patients and get them to connect with you. Dental work can be a scary experience, and I think it's important for your patients to basically vibe with you before getting started. Once we got back to work after the COVID-19 crisis, I found myself sharing stories about what I did during the mandatory time off, the daily walks with my wife, and how appreciative I was to have a job that has a purpose. And people really connect with these stories, and what's amazing is that they start to open up and share their own experiences and stories about their life. This connection makes it so much easier to do treatment together and get them back to health. Number 3, eye-to-eye communication. So many times I notice myself hovering over patients as I talk to them about their treatment, and this is totally wrong. It's really intimidating for your patients to look up at you when having these treatment conversations. I would really encourage you to get at their eye level, or sometimes even a bit under, to make things more comfortable for your patients. There are so many times where I'm actually kneeling on the ground and leaning in towards my patients as they tell me a personal story or a concern that they have about the treatment plan. Being a male dentist can be intimidating for our patients, and I'll do whatever I can to break that intimidation factor. So the next time you're in a room with a patient, make sure you look for that chair, sit down, get on their eye level, and have open, honest conversations about their treatment. Number 4, don't rush. We all have really busy schedules with complicated treatments and exams, but that doesn't mean we should ever rush our treatment conversations. Even if it's a returning patient, take the time to hear out their concerns and answer their questions slowly. Now, there are times when you have a complicated treatment plan and you're really busy and you don't have the time to go over their treatment clearly. If that happens and you need more time, it's okay to have them come back to present a comprehensive plan. If I have a complicated treatment plan and I need more time, I will tell the patient, hey, look, this is a complicated process. I want to go to my office. I want to, during my own time, look at your x-rays, look at your images, and develop a plan that makes sense. And I'm gonna go and create some options for you, and I want you to come back so that we can review these options and really have a clear understanding of what the best way to move forward is. And that's okay. And patients get that. I have yet to have a person get upset because I'm taking the time to do what's right. So take your time with your patients, sit down, have longer conversations, and I think you'll start to notice a much deeper, stronger connection with them. Number 5, asking if they have questions. This sounds super trivial, but it's actually really, really important. When the appointment is over, the last thing you want to ask your patients is if they have any questions for you, and then give them the time to speak. This simple question is going to help you identify anything that your patient needs answered, and once again, it will help make the treatment move forward more smoothly. I ask this question at the end of their appointment for every single patient, and I'm always surprised to hear what questions they have about their treatment. So give it a try, and I think you'll be pleasantly surprised. So those are my 5 tips for communicating with patients. Did I miss anything? Is there any tip that you would recommend? If so, make sure to leave it down in the comment section below so that we can grow as a community and just be better practitioners. I hope this helped dentists watching this channel that are looking to level up their communication skills. If you enjoyed the video, please be sure to like, share, subscribe, and I'll see you for the next one. Thank you.